In mid-Nottinghamshire, we've come together across the NHS and local government to change the way that care is delivered. Everything was fragmented and confusing for people to access. So the biggest challenge has been bringing together lots of professionals from social care and the NHS and all getting them to work in one team so they all understand each other's contributions.
Going back to 2013, Sherwood Forest was one of the 14 what were called KEO trusts. We had elevated mortality rates in our hospitals, and since then we've been on what I would regard as a fairly significant improvement journey from Sherwood Forest hospitals, from being one of the worst performing trusts on a number of metrics to one of the best in the country.
The purpose of the transformation was to change the way you change people's thoughts and behaviours about their own treatment, and also to change the processes at hospitals to actually change the way people are dealt with when they first arrive, in order to find a better way of making them more aware of local services.
The focus for the programme has been on developing a range of services outside of hospital, so strengthening community services in particular, and the aim of that is to reduce the demand for acute services.
No one wants to be in hospital. Nobody wants to be in a hospital bed, away from everything that they normally have at home, away from their loved ones, away from their cat.
We need to make sure that if we are going to give this care where the patient is in their own homes, then we need to make sure the different aspects of care is delivered at home. Multidisciplinary team is a way of organising that care.
Almost without exception, when all of the professionals come in the room, they're able to give some new information.
It's a way of alerting multiple clinicians in one room about multiple needs of one patient to prevent them from going into hospital.
So in Mornview, I started here in January of 2017, and from working here we've managed to do audits of the home to see why people were going into hospital. So actually highlighting that a lot of people went in here secondary to falls. We discussed falls mapping, so we have got a blueprint of the home and marked crosses of where people are falling, and it's a very visual aid that you can give to people within the care home and managers and say that these are your problem areas. To see the improvement of how the home was this time last year to how they are now, it is just amazing.
Call for Care is a service that was set up for telephone triaging from the wider community. We get calls from the ambulance service, from GPs, district nurses, palliative nurses. They ring us up and we do a 2-hour telephone triage to refer on to the wider community services, social worker or the nurse specialists. Before Call for Care, patients would have been referred to district nursing teams inappropriately, to nurse specialists inappropriately. Their hospital admissions would have been increased.
Call for Care can arrange home visits within 6 hours. They can also look after the social needs. That's not just giving medicine or treating illness. I think it is important that we do both. Look after the social needs as well as treat any clinical illness we find.
We've all committed ourselves to a system transformation and recognise that working together in a different way will bring about much better outcomes for citizens and people in our local communities.
So it brings all of the pieces of the jigsaw together, and it means that the plan of care can be much more joined up.
We've seen a significant improvement in the quality and safety of our services over the 4 years or so that the programme has been operating.
As we've gone through the Vanguard journey, there's been things that have worked much better than we thought and have had a massive impact, and then other things which haven't gone to plan, and we've had to revisit them and reintroduce different ways of achieving the same outcome. But overall, we've learned that by working together, we can achieve a lot more than we would have otherwise done.